Hello, I'm Esther Fieldgrass, and today I'm joined by EF MEDISPA's plastic surgeon, Dr. Christopher Johnsson, and we're going to be discussing breast enhancement. And Christopher does something called the Brazilian method. Coming from Brazil, he's very into bodies, and particularly the female body. So we're going to talk to him this morning about how he actually enhances the breast. Christopher.
Hi, how are you?
I'm fine. It's good to see you again.
Good to see you too.
So tell me about breast enhancement, the way that you do it, and why is it so different?
Okay, so we have two possibilities for breast enhancement. One is the traditional breast implant with silicone, and the other one that we've been doing a lot is the fat transfer to the breasts. The difference that we do is we filter a lot the fat, so we have pure fat when we put it into the breast, so our retention rate is much higher than what we see around.
Are you feeling that actually doing the fat transfer, it's safer? Is this something that people are looking at? Is that one of the reasons why it's become so popular?
Yeah, I believe so, because the fat, it's from the own person's body, obviously, from other areas where we can remove it. The fat it's not a foreign object. Silicone, even though it's okay in the body, it is a foreign object. Some people have reactions to the silicone, meaning that a capsular contracture could occur, and with fat, nothing of that happens.
I know in the past that when you're actually doing fat transfer, it wasn't retaining, so a lot of people were actually losing, although it started off quite large in the breast, it kind of went away. What's happening now? It's not the same.
Exactly. No, that is something that improved a lot with this Pure Graft. It's a system that we use that filters out the fat, so it takes a lot the impurities out. So what we put in the breast, most of it is retained. Obviously, some part will be reabsorbed, but a minor part in comparison to the old technique.
Okay, so when people are actually using their own fat, do they need to be quite large for them to take the fat out from one area and put in another?
Well, they do have to have at least maybe 2 areas that we could remove fat from. If they have too little fat, it won't be enough to give enough for a difference. So some people actually, believe it or not, they have to eat and grow fat before the procedure, if they really want that. But
okay.
Most people do have fat from other areas.
So something people always ask me about is how much bigger can you actually make a breast just using somebody's own fat?
Yeah, that's a good question. It doesn't substitute the breast implants. If you really want to go like 2, 3, 4 sizes bigger, you have to still go for the breast implants.
Okay.
But if you want to top up and go maybe 1.5 sizes, that's perfect for the fat.
Okay. So Christopher, I know there's been quite a few problems recently with the implants. Can you just talk a bit about that? I know it's affecting people's immune system, and there was a lot in the press about it. And I know we do, and you do, a tremendous amount of implants. So talk to me about it.
Yeah, there's this problem that's called ALCL. It's a type of a lymphoma that's restricted to the capsule of the implant. It occurs very rarely, but it has been occurring, especially with very textured implants. There are some brands that used to produce very textured implants. They're not doing that anymore. They don't even have a license in Europe anymore. So we have to go for the nano-textured implants if you want to go for implants. And then your risk of having a problem is much less. So, yeah.
Okay. So, do you think this is one of the reasons why people are actually asking more for fat transfer?
Yeah, I believe so, because patients that are looking for us, they want natural results. They don't want anything that's very big in terms of sizes. So if they want natural and they have some volume and they have extra fat, they're tending to go more for the fat transfer, and they're having excellent results. And we also can try to symmetrize the breasts a lot, because we've had patients who have completely different breasts from one side and the other, and then we can add much more fat on one side than the other, and they're more natural then, as opposed to putting different sized implants on both sides.
Can you also get an uplift when you're actually putting in the fat?
Yeah, we can, as long as it's not like really saggy and the patient has no volume at all. And then you have to again, opt for the breast implants. But if it's a slight uplift and they have some breast tissue and fat, we can put more fat and enhance the result, actually.
Okay. Are you also actually putting in fat around implants? I notice sometimes people have had implants and they still have a little sagging and they're coming back. Are you just taking out the implant, or are you actually enhancing it with a bit of fat transfer as well?
Yeah, we can enhance depending on each case. We have to evaluate each case, but it's possible to keep the implants and just add a little bit of fat for the contour, and that can give good results as well.
While we're talking about implants, how long should somebody keep an implant in for? Is there a period of time that they should change the implant?
Yeah, usually we talk about 10 years is like a good time frame, even though the modern implants, they could stay longer. Imagine 10 years from now, you have your implants, you're happy with your results, and obviously you go to the gynecologist and do your proper exams depending on your age. If everything is okay with that, you don't have to, really change it.
Okay. So talking about examinations, can people still have mammograms? Can they go and actually have to the hospitals, and how do they do it now?
Yeah.
With that, can you press on the implant and it's safe?
You can press with the implant. The doctors that read the mammograms, and they're very used because so many women have implants, so they're used to that. We can squeeze an implant right here now and just let go. It will go back to its normal shape, and no problem at all.
Yeah, okay for a man. Okay. So we're talking about the fat transfer and breasts, and I know, coming from Brazil, where the women are fabulous and they're used to having big breasts, fashion is changing. Are we still seeing as many large breasts being done today?
No, we're not. You're right. Fashion is changing. There was a time when women were going very big. I didn't like to do that. I always try to give natural results, and I take into consideration the person's height, the width of their shoulders. So you're not following like a fad, and suddenly now the size is gone down. So how do you go from a big size to a smaller size? You'll probably have to remove skin. So now they have more scars that were probably unnecessary before.
So Christopher, you were just talking about scars. Today, with all the advances in surgery, what are the scars like when you're actually doing a breast enhancement? So, or should I say breast reduction rather?
Sure.
So you're reducing the size of the breast. So how are you cutting? Are you moving the nipple? Is the areola coming up? Tell me how this works.
Yeah, so for it to come up, it obviously depends on how much excess skin each patient has, or how much breast tissue we're going to be removing. And the quality of the skin influences a lot. I frequently do the inverted T. Obviously, we try to make it small as possible, but I don't like to compromise and do a shorter scar than necessary and have an inferior result than what I would have. Because today what we use is this surgical tape for the scars. We don't have stitches anymore on the skin, so you don't have to come back for stitch removal. And that tape, what it does, it really helps to hold the tension in the scar. So after 3 weeks, when we're able to remove that, the scars usually are really, really good quality.
So talking about that, you're saying 3 weeks when you can remove the actual dressing. Yeah. So if you're having enhancement with the fat, or if you're having actually a surgical where you're cutting and not stitching anymore, do you have to wear a bra or something special? How long? Explain to me about that.
Yeah, patients already leave the clinic with 2 bras, one using obviously and one to change when the other one is washing. They should keep that special bra for at least the first 4 weeks. After that, they can go back to wearing normal bras, as long as they fit the bra properly. Because what I observe is a lot of women use the wrong bra, either the wrong size or the wrong model, with those wires, which are sometimes pressing against the breasts, and it has to really fit and feel comfortable. And
they wear them day and night?
They wear them day and night, yeah. They just take them out to shower. They're allowed to shower afterwards.
Okay. And is there a lot of bruising with this?
It depends a lot on each patient, but usually not.
Okay, so prior to coming in to have surgery with you, tell me what they need to go through. Talk to me about the consultation that you do with the patient.
Well, the consultation is really important because that's where I have a feeling of what's bothering them and what are their expectations, and if we're able to meet their expectations. And then we go through a large list of different issues that could go wrong or what they should expect since it's their first time. And in terms of pain, which usually no pain at all, or bruising or scarring or going in the sun. So we go through a lot of discussion points. And after that, they usually have to do some blood tests at least. And depending on their age, some breast examination as well, either a mammogram or an ultrasound. And after that, they're ready.
Okay. How long beforehand do they have to stop medication or?
Yeah, if they take blood thinners or anti-inflammatory drugs or even simple vitamins, I usually ask them to stop between 10 and 15 days prior to surgery because that could cause the blood to thin and they would bleed more than normal and bruise more than normal as well.
Okay, that's great. Is there any way you can ensure a great result?
Well, obviously, with my experience, I can already see a patient in consultation and imagine in my head and try to pass on to her if she's going to have a great result. If I think that the result's not going to be that good, I'll probably not do the surgery.
Okay. And is there any type of person that you wouldn't actually do?
Yeah, a lot of crazy people or people who have unrealistic expectations, patients who come in and they've had previous surgery and they talk bad about the previous surgeon for any reason. So those are at least ones that raise a red flag and we have to be careful with.
So Christopher, while we're talking about fat, I keep coming back to this because people are always asking me the same questions. Sure. Where are you actually taking the fat from when you're doing it, putting the enhancement to the breast? Is there one particular area? Can you take it from anywhere?
Yeah, we can basically take it from anywhere. Some areas are better for the fat. I would say flanks, the abdomen, the inner part of the knees, believe it or not. That's a good quality fat as well. So
there's good quality fat?
Yeah.
I love that.
We prioritize some areas, but we can remove it from basically any area.
Okay. So it's a double whammy. You can actually resculpt the body while you're taking the fat out and putting it somewhere else.
Exactly, that's the idea.
Very Brazilian. Talk to me about expectations. I know people come in and I meet many of our patients coming through the doors and their expectations are one thing. How do you deal with people's expectations?
Yeah, that's very important for me to sense what their expectations are. They have to be realistic, obviously. And I observe them and advise what would be possible in their case, because a problem that I feel nowadays is with the social media, because in social media everybody is beautiful, everybody is perfect, their skin is excellent, they don't have stretch marks, and that's not real life. So I sometimes, for some people, maybe the younger generation, we have to tell them that what they see there is not real. So as long as they understand that, we could go through with the surgery.
Okay. And here's one last question. Many of the patients who are coming in for breast enhancement, they've just had babies, or not quite just had babies, but they've had babies and they find that after breastfeeding, the breasts are sagging.
Sure.
How long after having a baby can somebody come in?
Well, usually it's more important than not the baby being born, but after they stop breastfeeding, we have to wait maybe 3 months. That's the time when the hormones during pregnancy and during milk breastfeeding, they go back to normal. So we have to wait for that, and then the breast will involute, will go back to normal size, and then we can do that. And it's also important to say that patients who have fat transferred to the breast, afterwards, if they want to have babies and breastfeed, they'll have no problem at all with that.
What about with an implant?
With implant either, they can breastfeed and everything normal, because we're not interrupting the breast tissue actually. So we're just putting fat underneath, and the implant is underneath as well.
Okay. So if people are having first child and then they decide, I really want the uplift, I really want to be back to where I was previously, and you do the surgery on them, if they have another baby, you can do it again?
No problem. We could do it again. Even if it sags a little bit, maybe she just needs an uplift after that.
So Christopher, something that people always ask is when you're doing fat transfer, if you put on weight, where you've done the fat transfer, is it suddenly going to blow up? Is it going to get bigger?
It will get bigger just like any other area of the body. So if you get fat, you get usually fat all over. You don't get fat only in one area.
And when you lose weight?
It will lose also. So the fat cells, they grow and they shrink. So depending on the amount of fat that you have in your body.
So when somebody's coming in to have a fat transfer, better that they're the weight they want to stay and maintain?
Yeah, they have to have some excess. They can't be too skinny and too much overweight as well. They have to be near their similar, you know, their ideal body weight probably.
Okay. So if anybody out there is watching the video and would like to come and meet with Dr. Christopher Johnsson and discuss their body needs, whether it be fat removal or fat enhancement, fat transfer, liposuction, please contact us through www.efmedispa.com or phone our Kensington clinic on 0207 937 5554 for your private consultation. Thank you.